Parkinson's disease is a progressive neurological disorder of the nervous system where a part of brain, namely substantia nigra, they start degenerating, and as a result, dopamine production becomes lesser and lesser over time. Typically, it's a disease that occur in people who are age 40 and above, and as the age increases, the prevalence also increases. But it is not totally uncommon to see Parkinson's disease in people aged below 40 also, and that is called young onset Parkinson's disease. So this is one of the older diseases which has a history of more than 200 years. It was first described in 1817. And if you look at the main symptoms of Parkinson's disease, number one is shaking or tremors, where the shaking affects mainly the hands and the legs, starts on one half of the body, and over a period of time, other half is also affected. Second is rigidity or stiffness of arms and legs. Third is bradykinesia or slowness of movements, where the person has slow walk, and also they tend to fall. That is postural imbalance. So these are the motor symptoms, and some people also have non-motor symptoms, which could be constipation and loss of smell, and sometimes bladder dysfunction. Now, these are the symptoms of typical Parkinson's disease. But some people can have symptoms that can mimic Parkinson's disease, but they are not Parkinson's disease. So, in that, commonly what we see, one is vascular Parkinsonism, which happens due to strokes in the brain, that is, lack of blood flow to the brain, and where the lower half, mainly the legs, are affected. Other is drug-induced Parkinsonism. So, in that, commonly we see antipsychotic medications used in treating psychiatric diseases, and sometimes medicines used for treating gas and acidity. So there are few medications that can cause that. So history is important. If we can, find out these medications, we can help in treating those patients. And then there are few degenerative diseases also that can mimic Parkinson's disease, and they include conditions like PSP, that is progressive supranuclear palsy, and multiple system atrophy. So in these conditions, there are additional symptoms. Like in PSP, there are involvement of eye movements where the person has difficulty in gaze. So up gaze and down gaze may be restricted, and also they tend to fall backwards. So with clinical examination, we can differentiate the two. And similarly, multisystem atrophy patients, they have autonomic dysfunction. So when they get up from a lying down position, they may have dizziness due to fall in the blood pressure, and also bladder incontinence symptoms may be there. Now, sometimes, when we have difficulty, as I said, most often with the help of clinical symptoms, we can diagnose. But sometimes we can't diagnose, or if we have a doubt, then we have specific scans where we can, they are called DAT scans or DOPA PET scans, which are available, which can help in diagnosing PD early in prodromal stage when the typical symptoms haven't started, and also in the early stage of Parkinson's disease. And once we have diagnosed Parkinson's disease, there is no need to worry because there are effective medications which can help in relieving the symptoms. And once the patients become more, severe in terms of symptoms, or the medicines are ineffective, or they have side effects like motor fluctuations, then surgery like deep brain stimulation is effective. And nowadays we also have MRI guided focused ultrasound treatments, which can do which without the need for deep brain stimulation. So that can be done in patients who are unfit for surgery. So in summary, I would like to say that Parkinson's disease is a common movement disorder. Mostly it can be diagnosed based on the clinical symptoms. And if you consult a neurologist, there are effective medical treatments as well as latest surgical treatments, which can help in living a good and decent life, almost free of disability.